Your health. In the final installment of our long COVID series, we're going to take a look now at recovery. For some of the more specific long COVID conditions, there are treatment options like medication and therapy. But for those people dealing with mild to extreme fatigue, some doctors are suggesting a different approach. Quad 4's Noelle Bellow joins us now live from the newsroom with more. Hey, Noelle.
Hey, Justine. Yeah, recent trends show there's an increased interest in learning how to heal with food and nutrients. Integrative health professionals say the way they've been treating people for years came in handy when long COVID patients started coming through their doors. A frustrating several months for long COVID sufferer Stephen Aquino.
My normal has been altered to a degree that makes me uncomfortable because my normal is always uncomfortable.
As a disabled man, he feared catching the virus would have unwanted long-term effects on his health. Now, several months after infection, he's still in the dark about why he suffers from lingering fatigue and brain fog.
My doctor, he was like, yeah, Stephen, we don't know.
While direct answers about the virus's ability to attack nearly every organ system in the body are still unclear, UCSF Doctor of Integrative Medicine, Carla Kwan, points to inflammation.
COVID kicks off whatever inflammatory patterns there were in your body, and it just takes them up to a whole new level.
The location of inflammation will vary from one person to the next, but most long COVID sufferers fall under histamine inflammation, gastrointestinal inflammation, and/or neuroinflammation.
People's particular constellation of long COVID symptoms a lot of times reflect what underlying inflammation they had that was maybe so subdued that they didn't feel symptomatic, and now they're very symptomatic.
In an effort to help those suffering, Dr. Kwan published a book. The Long COVID Solution offers a holistic, integrative approach to reducing inflammation within the body.
I first started out by laying out the anti-inflammatory diet, and there are 5 basic superfood groups where I tell them, you want to eat as much of this as possible because these will resolve inflammation, right?
Anti-inflammatory foods include cruciferous vegetables like broccoli, sprouts, and arugula, along with superfoods like berries, salmon, and cod. Walnuts, flax, and mushrooms are also on the good list.
And mushrooms seem to do all the right things for the immune system.
Dr. Kwan says avoiding high sugar foods and fruits as well as dairy, processed meats, and packaged foods are key. She also points to adding supplements like fish oil and vitamin D.
I think people are starting to realize the limitations of drugs and drug therapies with all the side effects they have, and they're a little bit more interested in having more tools.
She says it's about being mindful versus mindless when it comes to your diet, especially post-COVID infection. The book includes a gentle exercise program to help with exhaustion as well. While her approach is created for someone to make changes at home, Dr. Kwan does suggest having a conversation with your doctor.
Even before I had long COVID patients, I was astounded at how much the right diet and the right supplements can turn around like 20, 30 years of chronic fatigue.
As Dr. Kwan suggests, an anti-inflammatory diet is a great place to start. Justine, currently there's still no definitive test that can immediately diagnose a COVID-19 long hauler symptom. But doctors just have the patient's experience to suggest a connection between COVID-19 and whatever it is they're experiencing. So if you are concerned about how you're feeling post-COVID infection, you should see your doctor for a diagnosis.
So there's no way, like, you had COVID, to go get tests later on to know this is just normal fatigue of my everyday life versus
Correct.
a long COVID symptom.
Correct. There are, 12 common symptoms that could potentially lead a doctor to diagnose you with long COVID, but no, there is no specific test like how we would swab our nose for COVID. There's nothing like that for long COVID right now.
Great series, Noelle. Thank you so much.
Thank you.